All right, members, guests, please have a seat. So for those that don't know, I'm William Lambert. I serve as the House Majority Leader for the State House. And if I may, if you're a member of the State House, please just kind of raise your hand right now. Thank y'all for being here today. This is where the hard work gets done. It is an absolute honor to be with you here today to welcome to Tennessee a true champion for healthy America and our children's future. U.S. Department of Health and Human Services Secretary Robert F. Kennedy, Jr. Thank you, sir. The volunteer state has always led by example, and nowhere is that more evident in our bold steps to protect our kids' health, safety, and education. Last year, Governor Lee signed into law a groundbreaking measure sponsored by Representative Rebecca Alexander, which is the father of two teenagers was particularly special to me, and I was a co-sponsor. But beginning this school year, Tennessee classrooms are phone-free zones during instruction times. Thank you. There are obviously exceptions for medical needs and emergencies, but we've seen already the toll that screens take on our children. And you're going to hear a lot today about a variety of ways that we can protect our children. But that was one of the most important bills that we passed last year. These can be phenomenal tools, but I'm sure, as the Secretary knows, they can absolutely ruin children's lives and cause a variety of harms to them. So I wanted to highlight that just at the very beginning. And I want to introduce my very dear friend and the Senate Majority Leader, Jack Johnson.
Thank you, Leader Lamberth. Good morning, everyone. It is such a pleasure to be here to join Governor Lee and a number of my colleagues here from the Tennessee State Senate and the State House to welcome Secretary Kennedy to our great state. I want to thank the Trump administration and the Secretary in particular for focusing on improving the health of our citizens here in Tennessee. We are proud to partner with you and embrace the Make America Healthy Again movement. Tennessee is leading the nation in many ways, and there's a lot of things we can brag about. But when we're doing that, we should also acknowledge areas where we need to do better. And one of those is with regards to our health outcomes. Far too many national surveys rank Tennessee very poorly whenever it comes to infant mortality, obesity, diabetes, and numerous other health metrics. One of the drivers of these negative outcomes is lack of access to quality health care in some of our rural communities. This is why I'm especially excited about our Rural Health Transformation Act, which was recently passed by Congress. Thanks to the efforts of Governor Lee and his team, Tennessee will be receiving over $200 million annually for the next 5 years to help us expand health care access and modernize health care delivery across the rural parts of our state. Secretary Kennedy, I want you to know how grateful we are that you were instrumental in helping get that legislation passed. And I personally want to thank you and President Trump for partnering with Tennessee to strengthen rural health care and improve the lives of the people that we serve. We look forward to continuing our work together to build a healthier future for our state. It is now my honor to introduce a strong partner in this effort to make Tennessee healthy again, a proven conservative leader. Please join me in welcoming the Speaker of the Tennessee House of Representatives, Cameron Sexton.
Thank you, Leader. It's great to be here with you. Governor, thank you for this opportunity. First Lady, great to see you here this morning as well. Ms. Secretary, thank you for coming to Tennessee, and thank you for your family and what you have done in your history to help America and what you all have done for public service. So thank you for that as well, for what your family has done. And also thank you for the common sense of just flipping the chart. Sometimes in government we lose the common sense aspect of it, and they looked at it and it wasn't a milestone or anything. It was just, we need to flip the chart, and that makes more sense. And all of a sudden, everybody's like, that's wonderful. That's what we need to do. So that's what we are trying to do in our country, in our state. Listen, in our state, we're focused on providing better access, better affordability, more opportunity, as well as making sure that our individuals in Tennessee are healthier. There's many roads to do that. You're going to hear about that today. There's many great things that the Secretary has done to move us in that direction. Let me just say, in rural health care, We're looking at CON reform that we've done for years to limit the barriers, provide more access, to allow more opportunities for healthcare providers, for healthcare facilities to move into those areas to offer services, not have government be a barrier to that access, which is what we have sometimes through CON. We're also looking at putting providers and patients back in charge of their healthcare plan, not the insurance being in charge of your healthcare plan, to provide so that you all can do what you need to do. That's how we make ourselves healthier as well. And finally, I'll say this. One of the things to make healthcare more affordable and better access in our state is to actually define what a healthcare insurance policy is. What is a basic policy? And we can go to buy a car insurance, and we can go in and say we want the basic plan for our car insurance. You can't walk in and say I want a basic healthcare plan, because there is no definition of what that is. If we can do similar things, common sense things, that provide a starting point for us to have these conversations, whether it's about your food, whether it's about your healthcare policy, whether it's about providing the facilities to get into these markets, then we're going to be ahead of the game, which we are. It's great to be here with you today. Let me just say, it's my job also to introduce a mentor of mine. And listen, he's known me, I won't say for how long, but he's known me for a long time. And I've known him for a long time. He's a great public servant, a great friend to me. And I will always cherish this opportunity to serve along with him, but also to be able to introduce him as our Lieutenant Governor, Randy McNally.
Thank you. I'm tremendously grateful to be here and to get to be with Secretary Kennedy. I think it's a great honor that he has in coming to our state, and I really do appreciate it. I appreciate also your efforts to approve the SNAP waiver that Tennessee, Governor Lee and Tennessee put forward, which will allow parents to make healthy choices, encourage them to make healthy choices as far as the food selection that they have, instead of filling up on carbohydrates and sweets and things like that. But I think that's a great issue that you took care of, and we really do appreciate. I also appreciate your efforts with the Rural Health Care Transformation Act, and I think it'll do a lot to improve the quality and outcomes in rural communities. And I'm hopeful that we can work together. One of the things that rural communities need the most is capital and operating expenses, and I'm hopeful we can work together in providing that in the future. But it's my pleasure, really, to introduce our 50th governor, 50th in number, but surely first in our hearts, along with the First Lady. But we really do appreciate his efforts. He has suffered through a great many difficulties. We've had tornadoes, we've had ice storms, we've had riots, we've had bombings, and just about everything else you can imagine, floods, everything. And he has persevered through those and shown Tennessee's volunteer spirit and Tennessee's greatness. It's an honor for me to introduce Governor Lee.
Thanks, sir. Thank you. Thank you, Lieutenant Governor. Thank you all. Thank you all for being here. This is a great honor for us to have Secretary Kennedy here. Great opportunity for us to talk about something that matters to everyone. I met the Secretary last year. I was at the National Governors Association, a bipartisan meeting of Republican and Democrat governors. And Secretary Kennedy came and to talk about the health of America, a subject that cuts across all lines, that matters to every single person. I had the honor of doing a fireside chat and to lead a conversation with the Secretary in front of that gathering of governors across the country. And it was fascinating to me as we think about what he has done and what his leadership is doing as it relates to the health of our country. We all have known just intuitively over the last 10, 20, 30 years that something has changed in this country. When you think about cases of autism, the number of that really a crisis, or obesity and diabetes, why we have allergies for children, nut allergies that seem to certainly not exist to the levels that they did in decades ago, cancer diagnoses that are really different today than they have been in decades. Something has changed in our country, and someone needed to have the leadership to stand up and ask the real questions and challenge the status quo and find the answers to the questions that we all had of what is changing and why is it changing. Asking the hard questions, elevating the conversation, moving science toward finding out just what it is that we have done as a country that has changed the outcomes of Americans' health. We all also know that what we put in our bodies creates those outcomes. And it is practical common sense to ask the real questions. And I'm grateful that his leadership in this country to make America healthy again is something that matters to every single American. It certainly matters to us in Tennessee. We want to be a great partner. I'm grateful for President Trump and his focus on this. I'm grateful for the leadership that Secretary Kennedy has shown. Cell phone bans have been talked about here, funding whole milk, removing ingredients and dyes from our foods, making sure that our supplemental nutritional assistance program actually provides nutritional food. You know, when sugar is the primary ingredient in a food, it probably ought not to be in a supplemental nutritional assistance program. And we've made those changes all in an effort, and these are steps in the right direction, but they're all in an effort to be a partner with what's happening at the greater federal level in states all across America. This Rural Healthcare Transformation Fund, which is headed up by his office. I've met with Dr. Oz as well a couple of times in the last several months, both in Colorado and D.C., to construct our plan for that transformation in our rural communities. We know that clinicians should be able to practice at the full extent of their scope. We know that certificate of need laws have really held back investment in our state. We want Tennesseans to have greater access to health care right in their communities. And that's a part of what this Rural Healthcare Transformation Fund has done. So there are so many things that are happening that are a result of this man's leadership, and we are really honored to have him here. I'm grateful and honored to have him on stage today. Please welcome Secretary Kennedy.
Thank you. Thank you all very much. And thanks for welcoming me here today on my first stop on the Take Back America tour. And Governor Lee, thank you for leading the effort to make Tennessee healthy again and for partnering with us to deliver results. You are advancing MAHA legislation that puts prevention and community health first. You've made Tennessee the first state to add FDA-approved non-opioid therapies to Medicaid and extend these same protections to state employee health plans, reducing public dependence on opioids and setting a national standard. Your support for the Rural Health Transformation Agenda outlined in your recent State of the State address reflects a clear commitment to expanding access and improving health outcomes for rural Tennesseans. And I also appreciate your decision to allow former Deputy Director of Faith-Based Community Initiatives, Dr. Monty Burks, to come work for me running our faith initiative at HHS. And thank you for all the initiatives that you're pushing on fluoride, on food dyes, on cell phones, all of the MAHA legislation. And I also want to recognize several elected officials who are delivering results for the MAHA agenda. Lieutenant Governor Randy McNally House Speaker Cameron Sexton, Senate Majority Leader Jack Johnson, and House Majority Leader William Lamberth. We're all here today because we're facing an existential crisis in our country. When I was a little boy and my uncle was president, we had the best healthcare system in the world, and we had the healthiest people in the world, the healthiest children. And today we have the sickest. We have the highest chronic disease burden of any nation on earth. And Governor Lee was mentioning the autism rates. In 1970, there were studies there was a epidemiological study on autism, which is the biggest epidemiological study ever. And it looked at American kids and counted what the percentage was, and it was 0.8 per 10,000. That was the incident rate at that time, and people knew what autism looked like at that time. And today, it's 1 in every 31 kids. In California, it's 1 in every 19, 1 in every 12.5 boys. We are doing something horrible to our children. And nobody's been asking, why is this happening? The diabetes rate, when I was a kid, a typical pediatrician would see a single case of juvenile diabetes over a 40 or 50-year career. Today, 38% of our teens are diabetic or pre-diabetic. And so 1 out of every 3 kids who walks through his office door is at risk for diabetes or has diabetes. And the cost of this, national security, 77% of our kids cannot qualify for military service. And the financial costs are ruinous. When my uncle was president, we spent 0 on chronic disease in this country, 0. And today we spend $4.3 trillion. 40 cents out of every taxpayer dollar that goes to the federal government is going to treat chronic disease. And we're hurting our country in all these different ways. I'm going to talk a little bit about the things that we're doing first to reduce costs, and then to prevent this disease and to end the chronic disease epidemic. I had a meeting yesterday in my office to look at the progress of our AI initiatives. My agency is now leading the federal government and driving AI into all of our activities. It will transform medicine in this country with its capacity to diagnose and treat and prescribe disease, but it also helps us detect waste, fraud, and abuse. We are applying it right now to Medicare. We're going to save billions of dollars this year. Medicaid and Medicare get $100 billion stolen from us every year, and that's money that's not available for the poor and for seniors for whom those programs were designed. And we are now using AI, and its ability to detect fraud is extraordinary. And we're going to do that at the federal level in a couple of months. We're beginning at the state level as well, where we require cooperation from the states. Probably the most transformative thing that we're doing is MFN. We spend 2 or 3 times what European nations spend for health care, and yet we have the worst health. We're 79th in health outcomes. We lead the developed world in infant mortality. We've lost 6 years to Europe in longevity over the past 2 decades. We lead the world in maternal mortality. And many of the other criteria of healthcare, we have the highest chronic disease burden in the world, as I said. And part of the reason for the high costs is drug prices. 70% of pharmaceutical company revenues come from the United States, but we only have 4.2% of the world's population. We pay for the development of the drugs here, we pay for the innovation, and the Europeans are getting a free ride. And I'll give you one example, what my boss calls the fat drug. In the same injection that is made in a factory in New Jersey is sold in this country for $1,300. That's the list price. In England, you can buy it at any pharmacy for $88. We're paying 15 times what they're paying. And this is true for virtually all of our pharmaceuticals. We pay 2, 3, 5, 10, 12 times more than they do. And for many years, President Clinton promised to fix this and couldn't do it. President Biden, President Bush, President Obama, they all promised to fix it, and they got in there, and they figured out it was insurmountable. And I came in, President Trump called me 2 to 3 times my first 6 months in office, 2 to 3 times a week, sometimes at 2 o'clock in the morning, and said, "Where are you on MFN?" And he'd say, "Are you asleep?" And I would, "Yeah, I'm asleep." And he really drove us, and we put together an extraordinary team. We have a lot of, we've been able to attract the caliber of people to HHS like none in history. A lot of my employees came from walked away from billion-dollar corporations that they had started to work for practically nothing for this agency because they want to change things. And we were able to deploy, particularly one guy called Chris Klum, to run a negotiation team, and we were able to use the threat of tariffs to bring to the table 16 of the 17 pharmaceutical companies that we've now signed agreements with. And we are now going to have the lowest prices in the world. Whatever the lowest price is they're selling anywhere in the world, we will get that price or lower. And those will be available within 2 weeks on Trump RX. And the Wall Street Journal Americans can already get these prices. The Wall Street Journal reported this week that drug prices are down for the first time in 30 years. So we're going to see a tremendous impact and tremendous savings to the American consumer. And one of the things that, President Trump not only asked us to do MFN, which was impossible, but he said, I also want them to onshore all of their production. And I want not to end innovation. I don't want to destroy these companies. So this seemed like an impossible task. We were able to succeed in doing that, and the industry is now investing hundreds of billions of dollars in onshoring production here. Lilly is building 6 new plants, already broken ground. Novo Nordisk in North Carolina is building 4 plants. One of Lilly's plants, one of the biggest API plant in this country, maybe in the world. So next time there's a pandemic, we're going to be able to get the feedstocks for these medications. We're also looking at reducing prices through transparency. And during the transition, I was staying at Dr. Oz's house in Palm Beach, and we got a visit one day from former Prime Minister Rudd of Australia. And he, after he was Prime Minister, he was appointed the head of the commission to bring down costs and elevate the quality of health care in Australia. And he said the one thing that he did that made a bigger difference than it, that dramatically changed prices, was transparency. And so we're doing that here in this country. We are, number one, we're doing prior authorization. So then this is going to change the experience of every American who encounters the healthcare system. And this is another thing that presidents have been promising to do for a generation. Nobody's been able to achieve it. We were able to convene the 80% of the biggest insurance company, representing 80% of the American people, about 280 million lives. And they've all agreed now to get rid of price transparency, to get rid of prior authorization in all of the procedures that we ask for. There's some procedures that you want prior authorization. We don't want, somebody's getting a spinal surgery, we want to make sure they need it. We want to have some visibility there, but in the rest of them, at the point of care, if you go into a doctor and he tells you need a knee surgery, before you leave that doctor's office, you'll know whether your insurance company will pay for it. And this is going to... We also convened 400 of the biggest tech companies in this country, and they've all agreed to stop information blocking. This is another promise that's been made repeatedly over the past decade by various presidents. But right now, your health records, which you own, your tech company won't show you. And now we've got an agreement with all of them to make those available to every American so that you're going to have them on your cell phone. That means if you live in New Jersey, you travel to Oregon, you get in an accident, you won't have to sit for an hour with a clipboard before you get medical treatment. Your doctor will be able to access on your cell phone your health records. He'll be able to see your blood type, your allergies. He'll be able to see previous treatments and contraindications that you have, and it's going to save lives. And it's also going to be able to sync that with AI. Oh, today you go to a doctor, 80% of our doctors are now owned by a corporation. And those corporations are telling them you got 6 minutes per patient. But you can miss a lot in 6 minutes, particularly if somebody has a thick sheath of health records. But you'll be able to have access to AI, and you'll be able to check the treatment that your doctor prescribed or the drug you prescribed to see if there's contraindications. This is going to save a lot of lives, and it's going to, President Trump told me I want to make the American public, every patient, the CEO of their own health care. That you can make good decisions and that you'll have access to your own information. Price transparency during his first term, President Trump passed a law requiring price transparency. It was almost never enforced by the Biden administration. I've done more enforcement actions this year than he did during his 4 years. But now we've also changed the regulations. I started doing it on day one. They're now changed. Every hospital in the country is now going to have to publish their prices clearly, legibly beforehand. If you go to buy a car and the guy says, well, I'm going to sell you the car, but I'm not going to tell you the price till after you bought it, would you buy it? If you go to a restaurant and look at the menu, the prices are there. Healthcare is the only place where you can't see your prices. If you're pregnant in this country, you can go 9 months trying to figure out how much it's going to cost you to have that baby, and you will not be able to do it in many, many hospital systems. And so now you're going to be able to do it. We already have, I looked at the mock-up of the web page yesterday, and it was extraordinary. It showed, I asked the question, how much does it cost to have a baby within a mile of Manhattan? There were 30 hospitals, and they all have different prices. The lowest price was $1,300. The highest price was $22,000. And everything in between, $9,000, $5,000, $7,000, is complete information pricing chaos. How does that happen? It happens because there's no marketplace, because they don't have to share it with you, so they can charge you anything that they want. And that's all going to change now. And we're also forcing the insurance companies to publish how much they're compensating the provider for each service, and how much the provider is actually, and how much they're charging the customer, and how much the provider is being paid. That's going to allow large corporations that have a lot of employees now have a very good bargaining edge with those insurance companies, which is going to drive down costs, because we're creating a market. I'll talk a second about prevention. Speaker Sexton Cameron Sexton talked about flipping the food pyramid. When I came in the first week in office, we were supposed to publish the food pyramid then and the dietary guidelines because they had been prepared by the Biden administration. They were 453 pages long, and they were driven by the same mercantile impulses that had put Fruit Loops at the top of the food pyramid. This is not food. It's a food-like substance. And it was all driven by commerce. It was all driven by the needs and desires of the industry. And so we went in and we got the best nutritionists from the best universities in this country, got a dozen of them, and we locked them in a room. We thought it was going to be a month. It turned out to be about 9 months. And every word in it there was bloodshed over. Because, we were trying to make sure that we had the best science-driven recommendations for the American people. And we now have a food pyramid that, today, 70% of the food that our children eat is refined carbohydrates and ultra-processed food, which is killing them. It's just poison. It's giving them all of these chronic diseases, autoimmune diseases, and all kinds of emotional diseases. We now know that that the things that you eat are driving mental illness in this country. And Dr. Pollan up at Harvard has cured schizophrenia using keto diets. There are studies right now that I saw 2 days ago where people lose their bipolar diagnosis by changing their diet. It's not only affecting our physical health, it's affecting our mental health as well. And we're asking people now, eat real food, right? Eat protein. Eat fruit, eat vegetables, eat high fiber grains. And like Governor Lee said, this is just common sense. We're trying to deliver common sense and good policy to the American people. And then we launched Operation Stork Speed, which to fix our baby formula. We have the guidelines for baby formula in this country. There's 30 nutrients in baby formula. They were developed 30 years ago, and we have increased our knowledge of the micronutrients that are required to build brains in these babies exponentially since then, and they're not reflected. What we're doing now, we're also looking at contaminants, which are ubiquitous in baby formula. And in April, we're doing a comprehensive look at all the contaminants in baby formula. And we're going to release that report in April. We're doing a lot of other stuff, and I don't want to take up your entire day, but at NIH, we are now going to deliver gold standard science. And that was not happening in the past. And it wasn't happening because of corruption, because of an old boys network, and mainly because we didn't have the guardrails of replication. We didn't require scientists to replicate their studies. And there's all kinds of temptations to cheat if you know you're not going to get caught. And a scientist who gets a grant, if he comes up with a null hypothesis, in other words, the hypothesis that he was looking for, it does not pan out, he oftentimes cannot get that study published. It's still science. He can't get it published. And so there's a temptation to always find the positive hypothesis, to confirm your hypothesis with your science. And there was a lot of cheating going on because they knew they were never going to get caught. And now our studies are going to be, every study that we send out is going to be replicated. We're going to get good science out of NIH, and our job is not to tell Americans what to eat. It's to tell them what's good for them and to give them good information. If you want to drink a Coca-Cola or eat a Krispy Kreme donut, you live in America, you ought to be able to do that. Seeing the federal flow of money to rural areas to expand their health care, to rebuild infrastructure, to retain providers. And that is a crisis in rural areas. And I want to thank you for being here today and for your commitment. And these are doctors, associates who are going to go to rural areas and help deliver medicine, help deliver health care to those rural areas. And so it's going to increase the amount of money that goes to rural areas by a third every year for 5 years, and they all get a choice.